So from your own experience of having a therapist in your practice, what would you say the main advantages are for you and your team?
Yeah, I think I prefer the whole team-based approach. So even from a nursing point of view, I like them trained up in radiography and things like and sedation and things like that. So it's good to utilize the staff to their full potential. And it means that you can delegate out a lot of things that most dentists do and occupies a lot of their kind of appointment book, which is like the routine cons, hygiene work, preventive advice. So it frees up massively the dentist's time, so they can then go on to see more patients, do more complex work, and so on and so on. So I think personally it's a win-win for patients as well, because they get more time for the appointment. They don't feel like it's rushed.
Yeah. What would you say to a dentist or practice owner that's considering taking a therapist on but is a little bit concerned about maybe their abilities or cost effectiveness, like you say? What would you say to them?
They should have done it years ago, because it just makes sense. It just makes sense. Once you kind of get on board with the whole kind of team-based approach and delegating out things, it just becomes a more enjoyable environment for everyone. You don't have the stresses of doing all the little things that are simple tasks. So it's, for me, I speak to a lot of my friends who are dentists as well, and I tell them that you need to have a therapist, one or two therapists at least. So 100%, I think it's a must as well, really. In order to provide good care, you can't be taking all that pressure on yourself, otherwise corners get cut, and you don't want that.
Yeah. So you've been involved with foundation training for a little while. Would you say that foundation training is a good way to start your practice with getting involved with therapists?
Yes, because I haven't had the option here really to keep the previous foundation therapist on, just because of location, geography and things like that.
Yeah.
But the possibility is there because you've trained them up from the beginning. It's the same as having a foundation dentist.
Yeah.
Keeping them on because they're kind of used to your practice, the way you work, and so it's much easier to kind of keep the member of staff on, as long as other kind of factors are kind of favourable. The only issue we've had before is that previous therapists have travelled further, relocated to be here, so it's only on a short-term basis, but the potential is definitely there.
Good. And what would your comments be on the therapist's ability to clinical abilities and non-clinical abilities when they're straight out of university?
As good as a foundation dentist.
Okay.
Put it that way. So very good. They obviously need a bit of mentoring at the beginning, especially with COVID issue with reduced clinical experience, but that can be overcome quite quickly within a few weeks, really. So I personally don't have any issue with the lack of or reduced clinical experience they've had recently, but they're very good. They're very good. Yeah. Yeah, we didn't mention that, but I think the way the contract's going to go is that they're going to have patients are going to be in the chair for a bit longer. There's going to be more clerking of more information, so take more time. So the standard checkup with the patient, like previously as we have now, is definitely longer to capture everything. So that was one of my reasons for taking on a previous therapist before, is because I knew obviously things haven't changed yet, but when they do, you need the capacity to kind of keep going. Otherwise, it's going to slow things down. Yeah. For me, it's a no-brainer. I'd always see almost as like a must. In order to carry out good work, you can't be taking on everything yourself. No. You need to delegate, and then you can see more patients. Patients are happy. We don't really get any issues. For example, last year, my foundation therapist was just as good,